Welcome to the revision series. So, what I'm planning is to discuss this topic, that is the dengue hemorrhagic fever. So, it was actually asked as a short essay in 2014 in the university exam. So, not spending much time going on to the topic proper. So, just certain basics. So, what is a dengue virus? So, dengue virus, it is actually belonging to the Flaviviridae family, and it is an enveloped virus and which is containing single stranded RNA molecule. So the vector are Aedes aegypti and Aedes albopictus. Aedes aegypti and Aedes albopictus are the vector. So in the pathogenesis, there is actually a primary dengue infection as well as a secondary dengue infection. So about dengue hemorrhagic fever. Actually, this is a clinical classification where in 1997, the World Health Organization has classified the dengue into three clinical stages. So one is the dengue fever, second is the dengue hemorrhagic fever, dengue hemorrhagic fever, and third clinical stage, it is the dengue shock syndrome. Dengue shock syndrome. So in dengue fever, there is actually abrupt onset of high grade fever. There is abrupt onset of high grade fever. It is also called as breakbone fever or saddleback fever. Saddleback fever. This is actually a biphasic fever. Biphasic fever. In this dengue fever, there is maculopapular rash. Maculopapular rash over the chest and anterior limb, upper limb, over the chest and upper limb. And then in dengue fever itself, there is nausea, vomiting. So the patient will present with a nausea, vomiting, and loss of appetite. Loss of appetite. Then he may present with a lymphadenopathy. Lymphadenopathy. So the patient will be presenting with a headache, that is severe frontal headache. So there will be severe frontal headache, and there will be retroorbital pain. There will be retroorbital pain, and then there will be pain in the muscle and joint. So in the dengue hemorrhagic fever, so there will be fever. So this fever will be a high grade continuous fever. High grade continuous fever, and there is it is hemorrhagic, right? So there is actually thrombocytopenia. Thrombocytopenia, that is the platelet count less than 1 lakh per millimeter cube of blood. Less than 1 lakh per millimeter cube of blood. And in dengue hemorrhagic fever, the packed cell volume or the hematocrit, it is increased by 20%. Then there will be hepatomegaly. So the hematocrit is actually raised by 20%, and due to this thrombocytopenia, evidence of hemorrhages this evidence of hemorrhages can be seen. So there will be actually a spontaneous bleeding from the nose, mouth, from the nose, mouth, gums, and even from skin. And we can actually, so to detect the hemorrhages, we can do a tourniquet test. Tourniquet test. So the tourniquet test will be positive. So what is this tourniquet test? And suppose if you are measuring the patient's BP by using a cuff, by using the BP cuff, and for an example, if you get the BP as 100/70 millimeters of mercury, you have to inflate the cuff to a point midway between the systolic blood pressure and the diastolic blood pressure. That is, for example, in this case 100 plus 70 by 2. That is for the 85 millimeters of mercury. You have to inflate the cuff for 5 minutes and reduce it, and you have to wait for 2 minutes, and you can see a petechial rash in the anterior cubital fossa. And if there is greater than 20 petechial spot on the anterior cubital fossa per square inch area, that is greater than 20 petechial spot per square inch area on the anterior cubital fossa, that means the tourniquet test is positive for dengue. So next about the dengue shock syndrome. So dengue shock syndrome means the dengue hemorrhagic fever plus there is actually manifestation of shock. That means the pulse will be rapid and weak. The skin will be cold and clammy. Clammy means they are actually sweaty skin. There will be restlessness and narrow pulse pressure. There is actually narrow pulse pressure, that is less than 20 millimeters of mercury, that is hypotension. So this is what is meant by this dengue hemorrhagic fever. Now there is a more revised classification, that is 2009 WHO classification. In that there is actually dengue with or without warning sign and severe dengue. So by reviewing this dengue hemorrhagic fever, there is high grade continuous fever. Hemorrhagic means increased bleeding tendency. So there will be thrombocytopenia. That means platelet count is less than 1 lakh per millimeter cube of blood. So there will be increased bleeding tendency, spontaneous bleeding of the nose, mouth, gum and skin. So you can do a tourniquet test, it will be positive, and the hematocrit will be raised by 20%, and there will be hepatomegaly.